This mole that we all thought was fine, and in the back of my mind I thought was not fine, was malignant. And of all the skin cancers, melanoma is only about 4%, but it causes almost 80% of the deaths. It is a deadly form of skin cancer. The pigment in the skin becomes cancerous and it spreads through the bloodstream. And it's something that, if it's not detected early, is fatal.
The melanomas are usually sort of picked up by the individual, the patient, or a doctor if they've gone into their doctor and said, I think I have an abnormal mole on my arm. If they're diagnosed early, your doctor will cut it out and you'll be cured. If the tumour is diagnosed late, then there's a greater chance that it has spread to the lymph nodes or in a distant part of the body. And in that case, the melanoma is much harder to treat and the prognosis is much worse.
What we decided to do was to start on one part of my body at a time and basically take every mole off and see what happened. And we did one arm, then we did another arm, and what happened was they would start taking these off and the pathology reports would come back, and probably about a third of them each time had to be re-excised to get better margins. The standard of care for melanoma patients, as long as it's not at an advanced stage, is to just watch the moles and not continue to take them off, and only take them off if there's a change or there's suspect.
Unfortunately for melanoma, one of the statistics that people say is that if you were diagnosed 30 years ago with metastatic melanoma and right today in 2009, you have the same chance of dying.
My biggest fear wasn't for myself, my biggest fear was for my children, what this would mean in their lives and whether they would have a greater chance of getting it as well.
Most of these treatments for advanced stage melanoma work for very few people, and the outcome is pretty poor.
The challenge that remains in the melanoma community is actually tailoring those treatments that work to the specific person's tumour. And that's sort of the goal of TGen, is personalised medicine.
Probably the most exciting thing to come out of our lab in the past year to 2 years would be the discovery of a new melanoma gene where your risk of developing melanoma is doubled. And we're anticipating in the next couple of years reporting on other genes that influence melanoma risk. With this information, we hope to be able to better estimate on an individualized basis a person's overall risk for developing the disease.
And what we all hope is that when you get diagnosed with melanoma, you don't just get the one-size-fits-all treatment that you currently get today. In the future, you're going to have your tumour examined and they'll find out sort of what were the genetic aberrations that caused your tumour, and if we can identify those, we can identify new targets that we can develop new drugs against.